All right, a little bit about me. My name is Nelly. I was born in Nigeria, so that's where the accent's from. People are always curious about Americans are curious about accents all the time, so that's the accent, okay? For patient care hours, I was an ICU nurse for a year and a half, and then I went to the ED for a year, and that's where I've been since. I am an Emory PA student. That's where I go. I have a bachelor's degree. I have a master's in my prior life, and then I'm getting another master's now. And then I have an associate's in nursing. Fun fact, I'm a wife and I'm a mom. I have two children. They are 9 and 6. And when I'm not studying for PA school, guys, I am obsessed with K-drama. So if you guys like K-drama, Chinese drama, I'm your girl. Okay, that's me. I'm obsessed. All right, over. Mr. Matt, tell us about yourself, sir. Thank you for coming.
Uh, yeah, I appreciate you guys having me. I kind of started this whole TikTok thing back in January because I was bored at work, at my ER job. And so I kind of started this and then realized there wasn't a ton on the faculty side. And so there's a lot of students, there's a lot of practicing PAs, but I haven't found another faculty member. And so that's what kind of got it started, is just get the other side of it out. And I truly, like you can see there, I'm passionate about the PA field, even to the point of like, my story is I didn't give up. I applied right out of PA school, or right out of undergrad, with a 3.1 GPA, not realizing how competitive it was. And then ended up having to take a couple classes, go back and get my EMT, go get back my CNA. I was a paramedic as well, worked as a paramedic for like 3 years, and then reapplied. And so I've been through 2 cycles, applied to over 30 programs, and I got one interview and I got that one spot, and the rest is history. And so I truly, truly, truly love teaching. We just started our interview process. We had our first round of interviews 2 weeks ago. So we've just started that process at our program. And I mean, I love what I do. I love every minute. I've worked in orthopedic trauma at a level 1 facility. I've worked in ER at a level 1 facility. But now I'm at a critical access hospital. So I have like 4-bed ER that I work 24, 48 hours by myself. I do have a family medicine physician as a backup, but I'm 99% comfortable handling most things that walk in. So I'm also a girl dad. I have 3 daughters, so I try to stay up to date on a lot of the trends. But yeah, that's a little bit about me. So I've been teaching now for 2 years. January will be my 2nd year, and absolutely love teaching. So.
Okay, very nice. Thank you for sharing. All right, without further ado, we're going to start with traditional questions. And how I do this, or how I did it last week, if you guys want to do something different, I'm very flexible and open to let me know. But last week, what I did was I would ask a question, and I'll have 2 people volunteer to answer, and then we'll move on to the next question, the next 2 people. That way, everyone gets a turn. Does that sound good? Yes? All right. I'm going to model one just because I want to, and just because I want you guys to have an idea of how I do things. But then my way is not the highway, so don't do it the way I do it. But I just wanted to at least have you guys see how I did it when I was asked. I'll do one question, okay? Someone should volunteer and ask me, Nelly, tell us about yourself.
Nelly, how about you?
I love the enthusiasm. Thank you. You guys hear that? Is that echo, or is it just me?
I think 2 microphones were on.
Oh, I see. I see. All right. So I was asked that question on the day of my interview. I think both interviews that I had. And here's, even though I don't remember exactly what I said, but it was along the lines of cue music. Hi, good afternoon. My name is Nelly. I'm from Nigeria. That's where the accent's from, just in case you were wondering. I was born there, I was raised there, and I moved to the United States about 14 years ago at this point. I am married. I have 2 children, and actually, it was when I had my second child that I found out about the PA profession. Because where I come from, there are no PAs, NPs. That mid-level role does not exist. And actually, it was interesting that I found out about the PA profession through a nurse practitioner. I had this nurse practitioner during one of my prenatal visits she was just excellent. She went above and beyond the call of duty that it made me look up what is a nurse practitioner. And I just went round the rabbit hole looking at, what they do. And as I did that, I found this equally excellent role called PAs that functioned very much like nurse practitioners, at least in a hospital setting. But they had one thing that set them apart from me, and that was their ability to move laterally within the profession to meet the needs of their patients as they arise. And that's what sealed the PA role for me. And I've been committed ever since. It's taken me 5 years. I decided to be a PA when my son was in utero, and now he's 6. So it took me 5 years to get here. I went the route of going through nursing school, which is unconventional, but I wanted to make sure I had a very good foundation, as good as I could get before getting to PA school. Went to nursing school, got my patient care hours as a nurse, both in the ICU and in the ED. And now I'm here in front of you, and it's just the honor of my life and a privilege to be before you today. Thank you for having me. That was that was my spiel, a little bit of my spiel when I did my interview. Okay. So, one, I want you to tell me about yourself. Like, tell me something. Tell me 2 things. Do not just jump from your name straight to why you want to be a PA. As much as I want to hear that, before you're done with almost every question, if possible, I want you to find a way to weave in why you're going to be a good PA student or why you're going to be a good PA. Okay, that's the point of this whole thing. But it's a question about, tell us about yourself. So tell me 1 or 2 things about yourself, where you were born. If you have an accent like me, they are curious, I promise you. Tell them where the accent's from. Something about your family, where you got your patient care hours from, and then, of course, why you're going to be a good PA or something like that. Does that sound good? Yes. All right. Now it's your turn. I will let you guys, because for the MMI, I get to pick who goes first. So for this one, I'll let you guys volunteer. It's going to be the same question. So the first 2 people are going to tell us about themselves, and then we'll move on to the next one. Who wants to go? I see somebody smiling. If you don't call yourself, I will call you.
I'll go.
I love it.
So good morning, hi, or I should say good afternoon now. I'm Nicole. I am originally from Colombia in South America, and my family and I moved to the States when I was 5 years old, and I'm 22 now. So I've been here for pretty much most of my childhood and my whole adulthood. I decided to become a PA through, I guess, what is most of everyone's story, a personal health scare. When I was younger, my family and I had to go to the hospital because I was having really bad abdominal pain. And turns out my appendix had ruptured, and there was a bit of a language barrier between the providers and my parents. And this was actually included in my personal statement, where I pretty much found out that my appendix had ruptured before my parents did, because of the translator was talking to the provider, and I understood, and I was like, something rupturing in my body is not good. I was young, but I didn't know what it was, but I knew that it wasn't good. So that kind of created my pathway into wanting to go into healthcare. So I became a CNA to get patient care experience. And I'm not going to lie, at first, I did not know what I wanted to do. PA was not the first thing that popped into my mind. I did not even know what the PA profession was when I began my CNA career. But working in a hospital, I got to see so many providers, NPs, doctors, DOs, MDs, both of them, and PAs. And I did not know what the difference was. So I did a little bit of research. I started talking to a couple of them that would walk through the hallways. Some of them even let me see some bedside procedures. So I got to talk to them one-on-one too about their careers and whatnot. It was really fun. And eventually it led me to want to apply to PA school. So that's where I am now.
Excellent. Good job. I personally like the fact that you, one, told us about yourself, where you're from, etc. I love that you incorporated what I talked about of how you got here. I love that even without me guessing, you've told me you've done your homework. You did the homework. You've talked to people. You have, in a sense, what's the word? Informally shadowed someone to see what the PA role is. You are informed. This is an informed decision. This was not just any, mini, miny, you. you've done your homework and that's what got you here. And I like that. Mr. Matt, what did you think? You're on mute, by the way.
There you go. The one thing that I kind of came to mind when I was listening is, and when you said I was a CNA and then I was around a lot of other professions, I didn't hear a ton about what was in depth about why you liked the PA profession. You really said, I saw a bunch of procedures and it was fun. Well, I would like more than just fun, to show a little bit of dedication to the field. Because if you said, I looked around, I shadowed PAs, I shadowed MDs, I shadowed DOs, my next question out of my mouth, guaranteed, if I was interviewing me, is, well, why didn't you go to med school? So try to elaborate just a little bit more in depth on that opening statement to include things that you really enjoy about the PA profession and why you're there.
Agreed.
Thank you, Will.
I think that's where, at least for me, the next question I got right after tell us about yourself and that was, okay, well, why not NP? Like he said, like that was what I was asked. Why PA and not NP? And that's the next, actually, if you're listening, that's going to be the next question we do is why PA and not, because I need to make sure that, like I said, there's 2 questions you must have down. Tell us about yourself. Why not MD? Why not? If you don't ask that, if you don't get asked that question, just let me know. But I think it's something that you should be prepared, like, because that's the reality.
Yeah, it may not be specific. Well, why didn't you go to med school? It may come in a phrase of like, well, tell us why you really want to go to PA school. Especially when you said I shadowed, I worked as a CNA, and you even said in there, I didn't really know exactly what I wanted to do. Well, then it kind of alludes itself to, well, did you fall on PA just because? Or, did you fall on PA because you didn't want to go to med school? When I hate to say this, but I met with a pre-PA club, and we were sitting around talking. She's like, I just didn't want to go to med school. And I'm like, I'm waiting for that to apply because I'm going to ask her about it again if she gets past it. Because I'm like, that to me isn't a good enough answer. I chose PA school not because I wasn't good enough to go to med school. I chose PA school because I liked what PAs had to offer and didn't want to go to med school. So it's not a fallback, it's a choice.
Correct.
Could I ask a question?
Yeah, fire away.
So what would you say is enough to necessarily say about wanting to be a PA in the tell me about yourself? Because I'm thinking, like, if you I don't want to say all of why I want to be a PA in the tell me about yourself question. If they're going to turn around and ask me, why do you want to be a PA? Then I've already said everything that I kind of mentally had prepared.
So when I just, again, going back based on what you said in that is, I was a CNA. I got to shadow a few people, and I saw a couple procedures and it was fun. And then I did how I would spin is like, then I did more research on the ability to move laterally, the ability to work in a team. And those are the things that really drew me to apply today. And it's a quick 10 seconds, a couple extra things in there, but then not going super in depth and waiting for them. This is my interviews. Like I actually have 5 questions up here. I may not get to all 5 of them. I may get to 2 of them based on what you say is the answer, and I kind of have a flow of where I'm potentially going. And so if you do answer, potentially in that tell me about me, why you're here and why you're a PA, I may skip why you're a PA and go to the next question.
Exactly. If you give a synopsis or a summary in the details about yourself, then they're going to probably ask you more because you've only told us a little bit. In PS, we call it pimping questions. Like when you're doing anatomy demos, for example, you give them a little bit, they're going to, okay, now level up, pretty much is what it's going to be. And so, all right, I'll stop talking just so we can have time for more people to answer, okay? But it depends on what you say. If you say enough, because what they're trying to do is, again, get to know you and if you're going to be a good fit. If you tell me enough and I already have what I need, I already have the response I'm looking for, then I don't have to ask you again. It's not a, oh, we have to ask 5 of these questions. No, it's I'm looking for certain responses. And based off what you say, we either keep asking to get to where we want to go, or we just say, okay, we've gotten it, we move on. All right. Good job, Nicole.
Thank you.
Next person. Who wants to tell us about herself? Since we're okay. Lynnie, let's go.
Thank you so much for the questions. And I deeply respect the role of a nurse practitioner, but I feel like the PA professions align more with my values and the kind of provider I want to be. I want patient care focus, team-based approach, and adaptability. And I feel like as a PA, I can deliver quality care while still building a long-term relationship with my patients and still have that flexibility between multiple specialties throughout my career. And I also love the nature of the collaborative between PAs, and being a PA allows me to care for the underserved population sooner and focus on what's really mattered to me is to make healthcare more accessible and compassionate. And thank you.
Good job, Lynnie. Lynnie. I want to make sure I say that right all the time. I like that. I love your calm demeanor, by the way. It's very calm, very zen. I love that. I would say, I love that you did not shade the nurse practitioner profession, because that's what people tend to do, is they throw like subtle jabs at the other professions, which is a no. We respect every other profession all the time. Okay. One thing I would say is everyone's gonna say everyone is going to say lateral mobility in some way, shape, or form, because that's what sets us apart from it is the facts. What's going to set you apart is, why does lateral mobility mean something to you? Is it just because you want to play Russian roulette and do M&Ms and pick the next best thing? And is that why you want to be a PA, just so you can try everything you want to try with? Or, which is what something that I said, was being able to meet the needs of your community as they arise. Because what I don't want you to do is get in there and sound like even though you're probably 20 years old, like a 20-year-old person who doesn't know what they want to do and they want to, no, ultimately, it is for the patient. You are there to serve your patients, and being a PA who can move between specialties gives you the ability to meet their needs as they arise. And something I said during my interview was, I went to a pediatric ER as a nursing student, and it was a ghost town. Because why? Parents were scared of bringing their kids to the ER because they thought they were going to catch COVID in the ER or whatever. And so I said, where are all your APPs, your nurse practitioners and your PAs? And I was told that they got fired because you need patients to serve. And if patients are not there, then they don't need you. But the difference between the PAs who got fired and the nurse practitioners were trained as pediatric nurse or emergency nurse practitioners. PAs were generalist. And so even though the needs in the pediatric ED went down, the adult ICUs went up. And so guess what? Our PAs were able to be flexible and pivot to go serve the patients who needed them. That's why lateral mobility matters. It's not just for the sake of it. It's because when the day comes, when it's another, God forbid, another COVID, or the day comes when heart disease and all of that is not our biggest problem anymore, we are able to step there. All right, this is what our patients need. We'll go in there to fight. Well, not physically fight, but you get the point. Okay. That's why lateral mobility matters. Does that make sense? But good job. Good job, Lynnie. All right. That said, so we've got Lynnie. Gabbie, I saw you raise your hand. You can choose between tell us about yourself or why you want to be a PA and not MD, NP. Which one do you want to do?
I can do why not MD or NP. So why I want to be a PA. So I've always been interested in medicine from the time I was little. I always envied going to the doctor. When I got there, I always was just so eager to learn more. So when I got into college, I actually shadowed about every medical profession you can think of: pharmacist, PT, nurse practitioner, PA, MD. I enjoyed all of them. They were great. I loved medicine. But personally, I just the PA I shadowed really just encouraged me. I loved being able to interact with the patients. When I shadowed the MD, it was more office based or just diagnosing, not necessarily interacting with the patients. And I prefer face to face interaction. And then an MP, I just am not, don't think I have it in me to go to nursing school and then follow up with an MP degree, just because I do see myself having a family in the next 5 or so years. And I do feel like PA definitely matches my alignment with that. So that is why I chose to be a PA and apply to PA school.
Mr. Matt, you want to take this one? You're on mute again.
There we go. Yeah. So sometimes I can be a little bit more blunt, and I'm gonna try to be a little.
No, go for it. I'm sure they appreciate it.
Yeah. So when I hear you say, and I get the family scenario, the family, I want to have a family, and you pretty much told me that I didn't want to go to nursing school because I wanted to start a family, because nursing school plus NP school is less time, or is more time than it would be just to go to PA schools. That's how I heard it. Is PA school is only 2 years. If I had to go to nursing school and then NP, it'd be longer than that. And I just want to be a PA in a quicker amount of time. Well, to me, that's like, I don't know, it doesn't show a lot of passion about the PA field. And you can 100% like feel that way. And so I'm trying to figure out like just a little bit like, you know what? I love how, and you can spin that and say, I love how rigorous the PA program is. I love how the academics, the clinical hours, the didactic hours are a lot more and in a shorter amount of time, which gets me to my goal of being able to treat patients, being able to, care for patients, but also starting a family. And so you can use it to kind of combine on each other versus just saying, I just want to go to PA school because it's shorter because I want to start a family. Does that make sense? So I'm just, that was how I kind of took that, hearing that hearing that answer. And then I have, the one thing that I would just be really careful, my two best golfing buddies are two emergency medicine physicians that I've worked next to, hand in hand. And so I would just be a little bit careful of saying, the doctors only do this. The doctors are only doing diagnostics, or kind of how because two of my great friends and people that I work with but also hang out with we do the same job. Like, they spend just as much time with the patients. They may be a little bit sicker patients than I'm taking care of, but I just would be really careful on that kind of thing.
Agreed. I have to agree. What you said were my thoughts as I was listening as well. For the most part, I would say this, guys. If you ever ask the question about, if you want to speak to why you did not choose an MD or the NP route, I would say you start with, I respect what they do, leave them out of the rest of the conversation, and pivot it to why the PA is good for you. I don't know if that makes sense. Instead of spending time saying what they're not, or what they don't do, or what you didn't like about it, you respect them, you appreciate what they bring to the team, the end. Here's why PA. Everything comes back to why PA works for you, okay? And something else that you could add, Gabbie, to your response is, instead of, because Mr. Matt was very right. I heard, even though it's probably not what you meant to say, what I heard was, I don't have the patience to go through nursing school. I don't have it in me to go the nursing route, and that's not what you want to give. What you want to give is, I can persevere. I have what it takes to go the long haul, no matter what it takes, because at the end of the day, I want to serve patients. So something else that you can flip in addition to what he said was talk about the medical model. The medical model of things is different from nursing model. You may not have known that, now you do. Look into it, right? There is the nursing model. Nurse practitioners are trained under the nursing route or nursing model. PAs are trained under the medical model of things. That is something that you can bring. If you know, if you research it enough and you can speak to it, it's something that you can bring out. You really appreciate the medical model, without shading the nursing model. Does that make sense? We good? All right. Moving on to the next question. I had it open. One that, oh, no, we're not there yet. We're still here. One question that I think that you should also have, there are two questions coming to my mind. One is the strengths and weaknesses one. It's important because we want to know, well, not me, the admissions committee wants to know, again, let you know yourself. You know what your strengths are. You know where you're weak, and you know how to compensate for your weakness. Okay. Some people are going to answer that one, strengths versus weakness one. Another one is, what if you don't get into PA school this year? Now what? Okay, I want to, before I give my comments on that, I want to see how you guys answer it to see if you're getting at what I think you should, how you think you should respond to that. So let's have volunteers. Somebody who's not spoken, I'll give you the choice. Either tell me what your biggest weakness is. Let's do that one. I think everyone can speak to their strengths. Let's see how you handle weaknesses. Tell me about your weakness. Someone who's not spoken yet.
I'll go.
All right.
So I think my biggest weakness probably is that I'm a bit more of an introverted person. Like I'm never really the loudest in the room. Sometimes I tend to be like in the background, but I've tried to work on that. When I got to college, I tried to like start getting experience in leadership roles in clubs and different organizations to push myself outside of my comfort zone because I know it's important to be a leader. As a PA and to advocate for your patients, and you need to have that personality. So I've tried to push myself in that aspect, and still work in progress. But I think I've definitely improved on that. But I think that would be my biggest weakness. Yeah.
I don't know about Mr. Mai, but I loved it. I loved it because you told me what I wanted to hear, which is what you brought it back to why it's important that you work on this for your patients. You're going to know you're going to need to be able to work with providers, with doctors who may have bigger egos than Texas, and you need to be able to speak up for yourself, be assertive, not just for yourself but for your patients. And I love that you brought that in. So I personally loved it. Mr. Matt, what did you think?
I liked it as well. The other thing um, that you can say my introverted, like even in like you can spin it to, you know, what's their weakness. I tend to be a little bit more introverted, but in a team scenario, like like what it's like being a PA, I know when I need to speak up, but also I know how to be part of a team, and sometimes that is me being a little bit more quiet. You know, we don't need, you know, we can't have 99 in our class. We can't have everybody that's loud, outspoken. So we like people that are maybe just a slightly a little bit more reserved, but feel free to like knowing when to speak up and when to advocate. And so I like just a little bit maybe more in depth to that answer.
That's good. Very
Thank
good.
you for the feedback.
All right, who else wants to go? You can either do the weakness, or if you don't get it, nobody wants to think about this. The possibility that you don't get in. I know, been there, done that, but it's a possibility. You may not get in this on the first cycle. What happens if you don't? So choose either or. I'm cool with either. All right, you can go.
Okay. So I'm gonna choose the weakness question. I would say a weakness that I have is that I tend to be a perfectionist. I always try to make everything perfect and sometimes put too much time into things. And as I progressed through college, I learned quickly that I'm not going to have time to sit and make everything perfect. I would have to do things to the best of my ability while also managing my time. And especially with PA school, I know that the program moves very fast and that I'm going to have to adapt to that and be able to put my best foot forward and be confident in my work and not necessarily linger on things and try to make every little thing perfect.
Okay. I liked it. Again, you guys are nailing this. I liked it. Mr. Matt, what did you think?
Um, I think just to add a little bit to it, PA school is about prioritizing what's important and, really working on that to the best of your ability. And some things are going to take a back burner. Depending upon the week, you may have, heavy tests in one class and not in the other class. And so just want to be careful of I'm gonna continue to work hard. But I need to prioritize what gets and I like the word prioritize, or, I'm going to make, help set a list of what needs to be focused on and continue to use my weakness as a strength of, focusing and trying to be as close to perfect and close to, but also realizing that there's a lot of information and I won't be perfect. So you can kind of spin it to say, yep, my weakness is this, how I'm going to use it as a strength, but ultimately knowing it's potentially still a weakness of mine.
Because if that really is your weakness, it's going to serve you well in PA school, to be honest. I'm speaking from somebody who loves things to be perfect and excellent. Yeah, it serves you really well. All right, let's pivot and go into MMIs, if that's okay. First of all, are y'all applying to schools that do MMI interviews or no?
Yes.
You are? Okay, wonderful. Then let's go ahead and do it. My favorite interview was at Emory, and it was MMI, and I loved it. I was very nervous going in. I think everyone's usually nervous with MMIs, but it was great. One, because like I said, there's really no right or wrong answer. It's about your thought process, and to be honest, that's just how I did not have any answers memorized because that's just not how I will forget. Maybe because my brain doesn't work like that. I hate memorizing things. Even in school, I seek to understand how things work. If I can understand how things work, I don't have to memorize because I can walk you through, oh, the heart does this and it pumps in. Like that's how my brain works. I understand versus memorize. Okay. So that's how I want you guys to tackle MMIs. I have a system that I have used that I would say is tried and true, but then I've only used it one time. So do with that what you will. Okay. And so how I answer MMI questions are like this. Every time I'm asked a question, if it's an ethical based question, for example, you ask me a question like, oh, your friend calls you at 3 o'clock in the morning or whatever, asking you for a prescription for narcotics. What do you do? Asking you for opioids, pretty much. What would you say? So my system for that is this. First, I empathize. I always start by empathizing with whatever the patient's going through. Two, I assess the situation. What have they done? What has worked? What hasn't worked? Then the last thing I always do is to provide resource. Provide a resource because we never leave patients in the mud. Okay? We never leave them unattended. We never just say, oh, sorry, can do, no can do. You always provide a resource of some kind. If it's something that you cannot do by yourself, do not forget the PA profession, we are not lone soldiers. We work with a team. Use your team. If you need to tap in someone because it's something you don't know, like you asked the question that there might be some legal implications to it, it is okay to say, in addition to you have empathized, you have assessed, part of your resource could be saying, oh, at that point, I think it would be great to tap in my legal team, my ethics committee to come in and da 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 da. You get to the point. Okay. So this is about thought process. Walk me through what you're thinking versus just, even if you know what the right answer should be. Say you know, for example, that it is completely unethical to prescribe narcotics to your best friend. Do not just get to, oh, I will not prescribe da, 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 da. No, it is not about getting to the answer. I want you to walk me through your thought process. Tell me you've empathized. I want to know you've assessed the situation. So you're not just jumping leg first and breaking your feet trying to jump to the conclusion. Okay. Walk me through your thought process. Right. I feel like I've talked a lot, so I typically I would tell you how I answered that question just because it was a question I was asked, the narcotics question. But I think you probably have a good feel for how I do things at this point, so I would rather you get more time practicing. Sound good? All right. So how this one works is I have a list of questions that I made. We're gonna play Russian roulette, okay? You pick a number and I ask you the question, and I'll give you feedback based off your response. All right. Natalie, only because you haven't gone. Let's see. Is your mic fixed?
Is it still echoing?
Oh, praise the Lord. It's better. Let's go. Awesome. So you get to go first. Pick a number and then I'll ask you the question.
I'll say 6.
Next. Perfect. A patient makes inappropriate comment towards you. How do you respond?
This is just a generalized question, so
This is MMI at this point. So we've left. Did you hear my whole spiel about how I answer MMI
I
questions?
came in on the back end, but I meant like a generalized question about just what they're saying, not specifically about me being like a PA or wanting to see a doctor or.
It's just how I said it. A patient makes inappropriate comments towards you. You can give me, that's a good thought. I love that. You're thinking, oh, well, and that's something you can say. Well, it depends on the kind of inappropriate comments. Are we talking inappropriate comments regarding my body, myself, or it's okay. It's part of the conversation. Okay, so it's okay to clarify just like you did. Okay. So say I'm a good interviewer and I say, well, just say they said something inappropriate about your body. Go ahead.
Okay, so in that case, I would probably tell the patient that I would step out for a second and see if somebody else could actually see them, maybe a doctor, or talk to another healthcare provider to see how we should move forward in seeing the patient, given that they were rather inappropriate. I don't know if I would want to continue to stay in that room with the patient by myself because things can get lost in translation. But if anything, if the other healthcare provider is willing to step in the room with me to see the patient to ensure that they don't make any more inappropriate comments, then we can move forward doing that.
Okay, good job. So you really did hear the last tail end of my spiel where you never leave the patient in the mud. That's good. I love you brought your resource in. What's missing is the first two parts. Okay. Again, we always start with you went straight to the answer of okay, ultimately, if you feel uncomfortable treating a patient, you want to go ahead and tap a team member in to take your place. I get that. But two things are missing. One, again, why is this patient being inappropriate with you? You want to assess. Are they in pain? Are they uncomfortable? Something's wrong. Because many times when patients are being inappropriate, it is less about you and more about something they're going through. The wait time was too long.
You said about my body. That's why I had mentioned that.
Oh yeah, patients they'll say mean things to you because they're mad about something else. Like Mr. Matt, I feel like you wanna tag in this one.
I've been called every name in the book and I've stayed in the room because ultimately, yeah, it's uncomfortable. How I would maybe say is, hey, you know what? I'd try to figure out, why the comment was made, where the comment came from, what part of the conversation did the comment come from. But then I would also say, at this point, I would maybe address it and say, we're going to try to keep this visit professional. I didn't appreciate that comment. And just kind of, I tend to softly call patients out and are like, hey, you know what? I didn't appreciate that comment. Not sure where that came from. I'm here to take care of your medical needs. If you don't feel like I can meet those medical needs, then we can potentially find someone else to get you taken care of. But if you feel like I can handle those medical problems, then you can spin it. The other thing that you kind of alluded to, and I liked it, is, hey, I just didn't appreciate that comment. I'm going to grab one of my coworkers to come in and just supervise this visit, because it's all of a sudden 2-on-1, and it gets less of a he said she said thing, and it's now 2 on. Hey, I'm going to go grab a coworker of mine. I'm going to go grab a nurse. I'm going to go grab a tech, and we're going to continue this visit. If you feel comfortable continuing this visit, if you're not, then we can find someone at a later date. And so I'm just kind of going through this scenario and trying to play out. I tend to, hey, let's call them out. Let's make it a little bit uncomfortable, but you're still offering help. You're still offering them to get taken care of, which is what we want to see in this scenario, is how did I still get the patient cared for while still addressing the topic that was the poor communication from the patient.
Does that make sense?
Mhm.
Yeah. Okay. All right. Who wants to go next? I will call you. Delassie, let's go.
Okay.
Pick a number.
3.
3. A patient refuses treatment based on cultural beliefs. How would you proceed?
I think first I would take the time to understand what cultural beliefs they're referring to, understand their background, get to know them, and then work with them to try to figure out a treatment plan that kind of suits their needs better. If I'm kind of unsure of what to do, I might step out, work with my other team members, work with the physician that's on their team, work with other PAs, other just team members to figure out how we can best serve them. I might do some research myself to figure things out, but just definitely understand where they're coming from and then make a treatment plan that works.
Okay. I like it. I think it works. You want to always be respectful of people's beliefs, whatever it is, and you want to offer treatment alternatives as much as you can. If there's an alternative that does not step on their belief system, offer that. So I want to offer, because at the end of the day, especially if they're sick, if it's a sick patient, you don't want them going out and dropping and dying on the road, right? So you want to offer treatment alternatives that would align better while prioritizing their well-being. Okay, make sense? All right, good job. All right, let's have Lynnie. It's been a while you spoke. Lynnie, choose a number.
2, please.
2. I love it. Come on. Describe a time you had to collaborate with someone difficult. How did you manage it?
I think it was during my time as a medical assistant. I was instructed to schedule an appointment for an elderly patient. It's a follow-up visit in 4 weeks. But I remember from our conversations earlier, she had mentioned that she doesn't have reliable transportations and has actually delayed care because of this very reasons. And I had to pull the physician aside and have a private conversations, and I respectfully explained the situations. And it was very helpful that the physicians agreed to move the appointment to next week instead, when she still had the right schedule. And it reminded me of when advocating for patients to truly look beyond their symptoms and sees what struggles they might have faced. And I feel like it really taught me the importance of speaking up with respect and listens with empathy, and especially is for a greater cause. Thank you for the questions.
Sure. My one question right off the bat is, who was difficult in that scenario? Who was the difficult person?
I think it was me, because having to have a conversations with the physicians and having them to have to like move things around to get appointments to next week, I think I might have put them in a difficult position as well,
Okay.
regarding to time management.
Okay. You see, if I have to ask the follow-up question, that tells you something. One, you weren't very clear as to what the difficult situation. I guess I didn't, or maybe I just didn't hear very well, but I feel like there was not a very clear, oh, this is what was difficult about that. You know what I mean? Like, and you want to be very clear. That way you're answering the prompt. I don't want to I don't want to be fishing for what exactly was she trying to, you know what I'm saying? Like, be very clear as to what was difficult, why this was difficult, and how you overcame that situation. Overall, good job. Okay.
Yes, thank you very much.
All right. I haven't heard from Gabbie in a while. Gabbie, pick a number.
Did number 4 get used? I'm sorry, I did not remember which numbers.
No, you're fine. Number 4
Okay.
is still available.
All right.
Number you witnessed a classmate cheating on an exam, on a major exam. What do you do?
Okay, so for this question, I definitely think I would talk to the student first. Maybe go up to them, see if something was going on, whether they just couldn't sleep last night because of a situation at home. Maybe they were working, so they didn't have very much time to study. I would give them an opportunity just to explain their situation. If their situation was, worthy of maybe, I'm not saying that cheating is right at all, but maybe trying to find a way to still keep up. I would offer, to help them study, or maybe give them some of my notes just so they can copy it down in their own way before taking it to the professor. If it's something like they don't ever show up to class, I can tell that they're not very involved in the class. They don't care. They're just there to get the grade. I definitely think I would have a talk with the professor and just let them know. I don't think it's fair that this classmate gets to not come to class, not learn the material, and then find an easy way out, why the rest of us do have to study, do have to put in the effort. See how the professor feels about it, and ultimately we'll just decide then what happens to the student.
Right. Very eloquent. I like it. My response to that is, I do not think, and Mr. Matt, tell me if I'm wrong, but I don't think it should be your place to decide, oh, this student is putting in their effort versus this one did not, and this person, I don't think that should be your place, in my opinion. What I think I would say instead is, you started right, you want to assess how they got here, why did they cheat, da, 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 da. I would have said it's the next level to me was I would give them an opportunity to go talk to the professor themselves and own up to what they've done, because that's the right thing to do. Whether or not the student is a good student, comes to class, is irrelevant. Cheating is cheating. And so if they've cheated, I would give them the opportunity, go tell the professor what you've done, give them an opportunity to own up themselves. If they do not, then it is my responsibility to go on and tell the professor what's happened. What do you think, Mr. Matt?
I like that, because I was going to say, I'm just going to change the question and see what you think in the same context. You're in a clinic, you see a nurse is taking narcotics and putting them in her pocket, and you don't see her giving them to patients. Well, that's a slam dunk. I'm going up, I'm going to tell her, hey, I need you to either put those back, turn yourself in, or I'm going to turn you in. Cheating is the same way in PA school. Every program that I've talked to, cheating is a zero tolerance policy. And so I know it's a rough, like, hey, I'm going to give them the chance. Hey, I saw this. I don't know what's going on with you, but I need you to take responsibility. I need you to, go talk to someone about it. If not, then it's not fair to the rest of the class who is putting in effort and not doing this. And so then I'll have to take things into my own hands if you don't do them yourself. Because if you think about the narcotic situation, well, we're going to turn them in. It's illegal. And well, in PA school, cheating's illegal. And so we just need to find the right way to go down that pathway. But that's a hard and fast no for me.
Mm-hmm. Agreed. All right. Nora. So we have two more. Nicole, Nora, one of you. Either of you first, and then the next person after that. So choose.
I'll pick one. I don't think one's been said yet.
No, it hasn't been said. A fellow PA is consistently making medication errors. What steps would you take to address this issue?
So first, I would go talk to my colleague and find out if maybe there's something going on outside of work or something that's causing strain on the the colleague. Maybe like they're sleep deprived or there's a big family issue that's going on. Maybe it's not actually their knowledge of the medication. So I would find that out first, and then if there's an issue on that side of it, I would talk to them about it and see if maybe we could get help from that side. If it's more so they're having trouble with the medication or medical knowledge, I would offer to help maybe outside of work, go over things together because that could also benefit me. PAs are consistently learning throughout their whole like career. So we could work together and I could refresh my memory and we could work together to fix that. And then after exhausting all of those measures, if it continues to happen, I would maybe consider reaching out to um, a supervising physician more so from the side of getting extra help and to preventing like misdiagnosing patients rather than necessarily like tattling. It's not really from that side, more of like, if I can't help you, maybe we need another person to help. So we can just ultimately protect the patients at the end of the day. So there's not a crazy like mistake from the medication error.
Very good. I was waiting for that last piece, man. I was waiting for you to get there because ultimately, what's the big thing with medication errors? Patient safety. That's the big thing. We want to make sure we're do no harm. That's why we're there. And if your PA or your fellow PA or yourself is doing patient harm, that's a problem. Okay, so I wanted to maybe get there a little faster. I loved all the pieces that you put together, but get to the patient safety part kind of fast. Like it's ultimately about the patients. We're there to serve patients, keep them safe, and to get there a little faster, I would say. But other than that, good job. All right, last but not least, let's go. What number?
Let's do 7.
Number 7 is, sorry, goodness, Nelly. You're asked to perform a medical procedure you aren't trained for. What do you do? Think about it. Okay, you know what? That's part of the thinking process. I'll ask the question, I'll let you go.
Okay. I'm actually going to kind of take this perspective as a nurse asking a CNA to do something that they're not allowed to do because I've had it happen to me. So if I was a PA and there was a supervising physician asking me to do something I wasn't allowed to do, I would first go up to that PA and I would remind them that my scope does not entail what they asked me to do. And I would say, is there anything else I can help you with? Is there anything else I could do to make that process for you more smooth? But I would essentially not neglect, that's a bad word to use. I would just deny to do what that supervising physician has asked me to do. And if the supervising physician was still adamant about me doing that task, I would then go to another supervisor and just tell them about the situation and see if there's any other supervising physician I can work with or just hold them accountable.
Okay, I don't hate it. You did good. One thing that's missing from me is you did not offer to learn the procedure, which is why you're there. You're a PA student, a PA. Someone asked you to do something you don't know how to do. That's absolutely decline. You cannot do this. You haven't been trained for it. Why? Why don't you want to do it? You could learn on the job. Why not? Well, because patient safety. We're back to that, right? We're back to you do not want to put your patients at risk, but because you haven't learned it, what you're going to do now is you're going to learn it. You're going to offer to watch somebody who's better at doing it. You're going to watch them do it. That's the piece that was missing for me, where there was no, oh, I'm super pumped to learn this. I cannot do it yet, but the next time you ask me, I will be able to do it because what I'm going to learn today, I'm going to watch you do it, and we'll go from there. That's what was missing for me. Mr. Matt, what did you think?
So I think you could spin it and say, you know what, I've never done that procedure before. I haven't trained on it, but I would be glad to learn it from you. And puff up whoever's ego is asking you, hey, I'd love to learn it from you because you're probably really good at it. So I'd love to learn from the best. And then every procedure from there on out, then I'll handle it. But I want to see how it's done the right way. And all of a sudden it's like, boom, you just inflated their ego. They want to come teach, because then down the line, then it's on you. So, and you have to be careful of, like in the PA field, like for me in the ER, there are skills that I can do, but it may have been 3, 4, 5 years since I've done them. I still am responsible to do them because it's in my scope. I can do it. I may just need to go refresh. I may need to watch a couple videos before I go and do it. So just be really, like, if they're asking you on that is, hey, it's in your scope, but I don't know how to do it, then I need to, hey, I just need a refresher. Will you give me a quick refresher? I'll go watch a couple of videos, that type of thing, before I go and do it, versus it being completely out of your scope or really, I guess, illegal for you to do that. I feel like some people will play that card and like, oh, I can't do that. Well, you technically can, you just aren't comfortable with it. So it's how do we get too comfortable?
Perfectly said. Love
Thank you.
Would it be appropriate to ask the interviewer, do they mean like within the scope or not in the scope, or would you suggest just answering both sides and covering all bases?
I mean, if you get that question, I'd be 100% asked. I'm just asking for a little clarification. Are they asking me something that I just maybe not trained, or are they asking me something to do outside of my scope? Because it really changes how you kind of answer the question. If it's outside of your scope, I'm going to put a hard no, but I want to, maybe they don't know my scope. And I can go into, hey, here's my scope. Here's what I can do. This is actually technically outside of my scope, but I could probably help you find someone to do that. It's the anti-Walmart rule. Have you ever walked around Walmart and people are like, you look lost, and employees run away? Try to give them some help based on what you can do, or offer to find someone who can help them.
Perfect.
Yes.
Thank you.
I love that. And that's all of the interviews, guys. If you're asked a question and you're not sure, or there could be 2 ways to address the question, ask a clarifying question. That's that walking them through your thought process I was talking about. Say, oh, should I answer it? Will it be okay if I answered it this way as a PA student, versus ask the questions. It's okay. It's a conversation. They don't expect you to just like, oh, when we ask you a question, just start answering. Like, it's not rapid fire, okay? Ask clarifying questions if you need them. All right. We have a few minutes left. Do you guys have any questions just regarding life in general, being a pre-PA, whatever else you have to ask? This is the time.
I did have one question. So during your interview, I feel like a lot of nerves get involved. So if there's one question that I felt like it wasn't very strong or anything, is it appropriate to ask at the end when they're like, do you have any more questions for me? Is it okay to ask for a do-over, or do you just kind of like lose points on that one and just kind of work on the other ones?
My gut response says I wouldn't go back to a question. I can't say I've had it, but my gut reaction says, as the interviewer, maybe phrase it as, hey, do you mind if I add a little bit of extra answer to a question I've already had? Versus, hey, can I get a do-over? So you just admitted that you sucked. And so phrase it a little bit different. As we've gone through this interview, I've had a chance to think about one of the answers that I previously had, and I wouldn't, if you don't mind, I'd just like to add a little bit to that. Now I've completely changed my mindset of, hey, remember that question 10 minutes ago that I didn't answer really well? I'd like to answer it good now. No, hey, I just want to add a little bit more to that. So.
Agreed. Any other questions?
Mr. Matt, if you don't mind me asking, what is life really like as a PA? Like just beyond the day-to-day responsibilities. I love to hear your honest perspective, both the rewarding parts and the challenges as well.
Good question. So I work in critical access emergency medicine. So I don't know where you guys kind of all, you said, I've heard some Fort Worth, and I work in a town of like 3,500 people. So super, super small, but I'm in Omaha, Nebraska. So like we have 1 million people. So my town is huge. The city I'm in is big, but the town I work in is super small. And what I love about that is I wouldn't call them frequent flyers, but I have a certain set of population of patients that are sick or have a lot of comorbidities that I see frequently in the ER. And so I like some of I work ER because I don't want to spend a lot of time with patients, like 20, 30 minutes, but I also I'm from a small town myself. And so getting to know some of the patients a little bit better, because it ultimately, it betters their care when I walk in and I see the guy that has had chest pain 4 times in the last 2 months, but I also know from his previous ER visits that he's had all these tests done. So there's a good chance it's probably nothing, but I still have to do my job. So I like that aspect of it. And then the other thing of being a PA, like in the faculty department, I just love being able to give back to students. And so it's another opportunity going forward as the lateral mobility is also giving back to the students that I get to teach. And so my job is really rewarding. I love implementing change quickly, whether that's in students or in the ER. I love being able to, make people feel better quicker, or start to improve quicker. And that's what I love about the ER. But also, I walk out of the ER and I don't have any responsibilities, which has been really nice. Is I don't have to come back to labs. I don't have to come back to charts that are done. I don't have to come back to patient emails. I literally sign in on my shift and I work for 24, 48 hours, and then I go home. But that it does include nights and weekends, and you kind of maybe one popped in, but I'm a single dad, and so I have split custody of my kids, and so balance and schedule ER is perfect for that. So.
All right. Any other questions?
I will say that if any of you guys find me on TikTok or whatever and want to send messages or send, questions, feel free. I love getting questions from prospective students and helping out wherever I can. So.
All right. I wish you guys all the best. You will do great. Be confident. When you get there, you smile. You say, "How are you?" You talk to them like they're people. Okay. Don't be nervous. They're people just like you. Okay. They might look like they're like superhumans, but they're not. They're people. So say hello, smile, be confident, be passionate about the PA profession. You want to be a PA? Well, let's see. Let's see that you really want to be a PA. I wish you guys all the best, man. You guys would do great. All right, you guys. Bye. Thank you, Mr. Matt. We appreciate you. Thank you for doing this. I truly, truly appreciate it.
Thank you.
So much.
You guys have a great weekend.
All right. Bye, y'all.
You too.